Hey team, Tommy G, Middle-Aged Millennial. Coming to you from a very dreary day here on the Gold Coast. As you can see, a bit of cloud behind me. We've got some, let me just take this off the stand. And it's a little rainy. We don't have the usual perfect one day beautiful the next. You can see the rain. Look at that. You can see where the rain's actually hitting the sea there in the background. It's pretty stunning, right? Actually, let me check that out myself. Wow, that's what rain looks like when it's raining in one place. Isn't that amazing? Look at that. So you can see where it's hitting the water. It's like the cloud is kind of in the water, or water, as we say here in Oz. So we will be having Mr. Not just Mr. It's actually Doctor. Dr. Rouse is coming into the house. And there he is. I see him appear, and I put this back down. And we're going to be talking about posture. I mean, what's posture got to do with it? Good afternoon, Pete. So posture, what? It's like my psychological posture, physical posture. It could be. Knowing Pete is probably about something to do with physical posture, physiology. Let's bring him into the house. Yes, in comes Dr. Rouse. Let's have a look. No, it's not letting him in yet. So we'll just give Facebook a bit of time to catch up and screen him, check him, whatever, before he comes in. Who knows? There we go. Okay. This has popped up. Approve. Keep this for 30 minutes today. How many times have we said that before? Depending on how much engagement we get. But posture is absolutely key. And, we're talking about corrective type stuff here on Tune Up Tuesdays. Tune Up Tuesdays. And a little chilly over there, is it, Pete?
Just a little bit. I think it's I'll give you a temperature recall right now.
Let's have a look.
I'm guessing 12. What's it saying? It says 14 at the moment, but it feels like 12.
It feels like 12.
Celsius.
We are talking with Celsius, of course. Right. Wow, yeah. 12 Fahrenheit. Now that would be chilly.
Hi, Charlie.
So, I've been saying, should be giving you the due respect of your hard-earned title, Pete, of being Dr. Rouse. You are a PhD after all.
After all.
After all.
I'm trying to share this right now, but...
Oh, yeah? It's not working?
Yeah, it's working now. There we go.
Okay, there we go. Pete, obviously a little chilly. Yeah, where are you? Wellington, Auckland, Queenstown?
Home. Remember that tree?
I think I remember that tree.
You sit right next to it on the table.
Oh, right. Okay. I do now remember that tree. Now, I remember the backgrounds for sure. Okay, you've got a little bit better weather than me. We've got a rain cloud. In fact, have a look at this, Pete. You can actually see where the rain is hitting the water. Isn't that cool?
That's pretty cool.
That's pretty cool, right? There's Mother Nature doing her thing right there, raining on the sea and not raining on the sea. So
we just got back from Auckland, and apparently today it's up north anyway. It's like that as well.
Oh, right. Okay. So
we missed it.
Always
luckily.
A little cooler. Yeah. Right. Okay. But always a little cooler down there in the land of the Kiwi, mate.
Yes, and I'm ready for Canada weather, including in a couple of weeks by the look of it.
It looks like you're in training for sure.
Yeah,
you've got the gear on. So, mate, posture. I haven't heard a phone like that for I don't remember how long.
That sounds like a.
Is that your phone calling? You've gone and used the old. Ringtone. Oh, okay. He's answering it. Obviously, that's why we've frozen up.
Oh, do they?
There we go. Sorted. Love the retro ring on the phone, mate. That brings back some memories.
You're welcome. I didn't even realize that was mine actually, because I got the noise cancelling headphones on. So
right. So
I'm going to turn off the phone part for a little while.
All right, sweet. All right, Pete. So posture. Now, we talk a lot about exercise, a lot about eating the right foods, and it's interesting how things like sleep or recovery stuff is where there's a lot of low-hanging fruit right now, as well, right? And when we talk about posture, and the only part that comes into my brain when I think about that is, okay, sitting down for too long, need to stand, sit, need to keep moving. But posture is a bit different. Posture is about then if you are sitting, sit properly, or do this exercise properly, or whatever. I'm guessing. Can you kind of take us from there on the scope of what posture is, and then what's a good posture? How do we get there? How do we make changes?
Okay, so first part of the question is, what is the posture? What we're looking at is the alignment of the overall organism, being the human body, and the segmental segments of that body as well. So you want to look at the overall posture, looking at the organism. You often hear common phrases like hyperlordotic, or your increased kyphosis, head forward posture, maybe hunchback, which is related to kyphosis. So you have all these terms coming in, which really referring to the bigger picture. But then you also have to have a look at the segmental aspect as well, and that kind of puts the whole postural perspective into view there. Now, the second part of your question was that what was the second part of your question there?
I'm going to say I'm not the only one that does this. So then, once we understand the scope of what posture is, then what is it that I'm amazed I can actually remember? What is it that is going to be a correct posture? The right posture.
That's right, the correct posture.
Yeah.
Now,
right.
This is where I got sidetracked.
Okay.
So the correct posture. Okay, we have an understanding of the ideal alignment, which is if you're looking at different views of the body, from straight on, from the side, cranial view, from the rear. We have an ideal situation we're looking for. So when you're looking to create the ideal posture, it's a never-ending battle because of the environment we're in. Sitting down, not really ideal. Just everyday environment we're put into every day is always counteracting, getting us into that ideal posture. So when we're talking about ideal posture, we're always just striving for that never-ending goal. It's something that you can probably never truly 100% achieve, but your goal is to get as close as possible.
Right. Okay. So, we can be talking about doing many different things, right? From sitting down to doing an exercise, to how we're walking, then to how we're lying in the bed, perhaps, whether we lie on our stomachs, our backs, our side, how we pick things up.
It's actually a lot more deep than that.
Oh, yeah.
Think about your sensory system as well. So your hearing, for example. Your hearing can affect your posture dramatically.
Wow.
Just think about one really simple way of looking at it, and it does get deeper than this, but look at one simple way of doing it is, if you're deaf more in one ear than the other, you're probably going to be drifting that neck forward on one side more, listening to someone or listening to conversation. So that's going to be drawing your posture out of alignment all the time there. There's other factors related to balance, and with the auditory system, there's balance factor going into that as well. The eyes. Yeah. So we've talked about that before when you were here, but with the eyes, that's a huge impact. And we're not just talking whether you have clarity of sight. We're talking about convergence, and where your eye tracking, your motor tracking with the eyes, all that does influence your overall posture. And then we're talking about jaw, mouth, teeth, all that affects your posture as well.
Wow, I had no idea. I mean,
that's just for looking at what's on this structure on the head.
Right. I mean, because it could be, one eye could, either if it's one lower or one that's worse than the other.
Well, that's all often related to the cranial position. So the bone structures of the cranial can be shifted slightly, which can actually cause a shift in the eye position. Now, some people are born with deformities, but it's not as common as you think. When you see someone walking around with kind of that slight shift in the alignment here, that often can be corrected.
Whoa! So
Remember, these joints can be adjusted or manipulated.
isn't that amazing? I mean, you think the tissue is pretty well kind of fixed as a standard generic human being, and that this is what I
They're
am.
still
But
joints. They're
it's
still
still
joints.
joints, and you can still move the stuff.
And then there's
Whoa.
also the reflex onto the TMJ as well. So with the TMJ, that can cause a shift in the alignment as well, into the
Right.
temporal bone and structure as well.
Wow, that is crazy. All right, we've got a few people who have joined here. Junaid Wazir, are you a professor?
No,
No.
I'm not teaching. I'm retired.
He's a
Everything.
doctor. There we go.
I'm retired.
Right. He's chilling. He's in the chiller.
I'm bringing up my daughter.
There we go. Gets to do it undistracted. And 2 dogs and 5 cats.
One's sitting right down here at the moment, and the other one's waiting for me to let her out.
What, the child or the cat?
The dogs. Dogs are here.
Dogs.
So Sasha,
Right.
Sasha, the puppy, is right next to me right now. She's just having a chill right next to me.
Oh, nice. Yes, the energetic. Hang on, Sasha was
That's the energetic one, yeah.
Yeah, the crazy
That's
one.
the hyper one. Yeah,
right,
she's
the
on
hyper
a long.
one.
She's on lead. On a long
She's on
lead.
the lead, as usual. Right. Okay.
Yeah.
Just make sure it's not wrapped around your knee this time.
Yeah, exactly.
Yeah. We've got Anne and Anne. We have Anne times 2 on as well. Hi, Anne's. So, mate, all right. Well, this is fascinating already. We're talking about your sensory stuff affecting your posture, be it your eyes or hearing. We've got you can adjust, like, where the jaw is joining and so on, and start to line these things back up, because obviously you get that domino effect. If there's anything I've learned from you, it's like one thing's wrong somewhere, and that may be even a symptom, and how that kind of traces back along the dominoes to somewhere else. And then, what are you doing over there, dude? But the problem's here. And it's saying, no, that's the symptom there. The problem's actually over here. So what do you do? How do you check someone's posture with this sort of stuff, which sounds complex? And then how do you fix that stuff?
Well, we've, when we were here, we did that video which went through, which is going to be on the other page there.
Yeah.
But we did that video of the more of a very watered down assessment to give people an idea of the assessment process. And from that, we did see a couple of issues on you. I'm not sure how things have been going with the new lift, but coming back to, like we're talking about posture symptoms and causes, going down the other end of the body with the feet and the lower body, the feet particularly, or leg length, we're talking about for you. So another factor is with leg length discrepancies is very common.
Right.
Research showing around about 70% of the population have leg length discrepancy. Now, it's a much less percentage having that one where the medical establishment would say, okay, that needs intervention, and that's usually at 1 inch or 25 millimeters, which is 25 millimeters is huge. But we are seeing severe compensations occurring with as little as 2 or 3 millimeters leg length discrepancy in some cases. What we're often seeing is average is usually 4 to 6 millimeters is kind of the average leg length discrepancy when we do see it in an individual. I believe you were 4 or 5. What were you?
5,
5, I think.
5? Yeah.
Yeah, I think you were 5
5
millimeters. So
How many slices of the plastic did you cut? Was it 3?
5.
5.
No, it was 5, I think. Yeah.
Right. So
It might be it basically paired up with another test you had done before.
Yes. Yeah. That's right. And so we've got the extra layers of plastic. It's amazing. It's like that plastic tablecloth stuff, which is just kind of layered.
It's PVC.
And, PVC. Right.
Mm-hmm.
Yeah, I think about it every time I put on my runners now, because obviously that's where I'm going to have most of the impact. And need to get that in my others as well. So the body's kind of used to it. How it's affecting my alignment and whatever, I don't know. You'd need to do a check, but that was pretty fascinating. How you had calipers and everything, where you were checking my whole biomechanic structure, basically.
And looking at that leg length discrepancy, what we can also tell there is the shift in the pelvis. So how the pelvis shift on one side compared to the other, because remember we're measuring the ASIS, the PSIS angulation there, and that was not off the top of my head, but I think it was like 10 on one side and maybe 5 on the other. But when you correct that leg length discrepancy, it balances that out. And that's without doing any
Right.
hands-on manual therapy work. So that realignment can actually really help with aligning the rest of the body, including your head and the cranial shoulder position, all that.
So, yeah, look, I found it fascinating because I thought, wow, it's only a few millimeters we're talking here. The fact that you actually found it, how you diagnosed it and found where it was. And then let's say, you know, and you could talk about my case or maybe a more spectacular case. I'm hoping there are some more spectacular ones where that can affect you. How? Elisa's just joined as well. Hi, Elisa. And just before you answer, mate, we've got here from Anne. I had a leg discrepancy for years. When the pelvis was finally balanced and released, I don't have it anymore. So,
well, it wasn't
great,
leg length discrepancy. That's actually not a leg length discrepancy. What was happening there is the pelvic realignment was causing the leg length to shift. But when we're measuring it, we're actually measuring individual bone to bone length. So we're actually not measuring the overall leg length from the pelvis, because the pelvis is separate from the leg. So you can't measure from the pelvis to the foot or whatever to measure leg length, which is the old way often they were doing it. We're looking at segment to segment to segment to segment. You were in the tibia length was actually shorter on you. So that's where you actually lost the leg length was actually in your tibia length, or your lower leg length there.
So that actual bone segment was actually shorter, is what you're saying?
Yes, yes. And that can occur for so many reasons. It can be anything from, you know, very dominant in your sport, growing up like with Anne with soccer, you know, soccer or football, whatever you like to call it, depending on what country you're in. So
yeah,
with that could be a factor. Hi, Lisa. And then it could be also an injury that's occurred when you were younger. You broke your leg when you were younger. You're kind of restricted on that for quite a time. There's many factors can come through it. And usually those growth restrictions occur when you're growing. So anything from, you know, from the time you start walking through to, you know, when you finally stop growing, which for people that varies a lot.
So I look at that. If I look at my past, in my case,
hey, Paul.
Hey, we've got and Christopher's joined as well.
Paul Chapman's on there. He's from New Zealand.
Oh, lucky guy. Only if he comes.
No, he's in the North Island, not so lucky.
Yeah. Right. Sorry to hear the news. But when I was, I played cricket for 20 years, and I started when I was still probably forming, at the age of like 10, 11, and I was a bowler. And I used to land hard on my right leg. So that was getting compressed quite often as I'd hit the deck, right, coming in for the final delivery stride. And so I'm wondering, that could have caused the compression of the bone length. I don't know.
It could. We don't know for sure which or what, you know, condition or factor that may contribute to cause that. We can't say 100% it was that. It probably was something related to that and other things along that line. So there's no kind of definitive kind of answer to that. But there is a good probability that is a factor involved with it. And it's usually not just one thing either.
Interesting.
Often people are, you know, like single, like either right hand or left hand dominant. So that can play a factor into it, especially when they go into sports that are single, you know, limb dominant or something like that, and that could play a factor. Injuries like with Anne with ankle, knees, that can play a factor as well.
Right. Okay. So if you've got this sort of an issue, then and you don't give it the attention early enough, does it then become a chronic issue or causes a chronic issue, or how does it then manifest in some form that holds you back or negatively affects you?
Well, that's a possibility. Now, I can't say, everybody with poor posture is going to have chronic issues. That's not the way it works.
Right.
There's other factors involved there with tolerances involved with that, stress tolerances on the body, pain tolerances for the individual. But I can tell you that we're pretty confident that with the poor alignment posture, that you have a more high susceptibility to injury from activity. That's for sure. It can reflect on respiratory patterns, so it can affect on your breathing, other functions there. that can thereon can affect blood pressure, can affect cardiovascular health. You know, there's a big roll-on effect that could occur from poor posture. With the driving head forward posture, for example, that will also affect breathing. You become more mouth breathing and nose breathing. That can affect a whole lot of factors there. Then that will change the shape and structure of the jaw. It just, the list goes on and on. It's a huge snowball effect that can occur. So if you're looking at optimizing your health, I think starting with posture when you're looking at the physical aspect could be a big part of that component that you want to look at, because if you're trying to do all this other exercise, you're building on a bad foundation, then all you're creating is a very unstable structure on top of that, and you're never going to hit that peak. You're going to get to a certain point, injury is going to bring you back down. Get to a certain peak, then injury is going to bring you back down. So take your time to build that strong foundation before you kind of try to rush into doing more complex stuff, like going off and doing, you know, stuff like CrossFit or PX 90 or whatever it's called,
TRX or whatever it is.
Yeah. All these kind of high intensity stuff as well. So, you know, before you kind of rush into that kind of advance, build that foundation up. With that foundation involves correcting a lot of that malalignments and segmental stability as well.
Right. Okay. And like, I mean, you spent a fair amount of time, and we took a number of videos on this, like you said earlier on, which are going to be
posting those tonight, right?
We are onto hill.me. So we'll get those on, and people can then see what we're actually talking about here as far as how it was sort of
and that's
diagnosed,
the watered down version. You know? That's the watered down version. That's very watered down. Usually my postural work, you know, like the assessment process is 2 hours.
Right. Yeah. Okay.
In a clinical lab, yeah, like I'll set up, it's 2 hours worth of work just to get, you know, good foundation there, looking at that.
Right. So what other methods are used then to put some corrective action in place? For me, it was the PVC.
Well, that's one part of it.
Okay.
Yeah. Once you kind of, okay, let's say you find a leg sensitivity, you correct that, or you don't find, and it's okay, but you find other areas. Often we see stuff around the pelvis, for example.
Yeah. Right.
So your pelvis rotation is more on one side than the other. That could be affecting the sacroiliac joint. So we may need to look at, okay, is that SI joint moving freely, or are there facet joints in the lumbar spine rotating and moving, flexing, you know, freely as well? So, you know, those things, even after we correct the leg length, if there's a problem there, then we have to go up there and see if these joints are moving again properly. For you, your SI joint started to move okay. Right. Not perfect, but was better.
Yeah, yes.
But your facet joints in the lumbar were not. So we actually did a little bit of work on that member and actually opened those up. Yep. Remember, you were bending forward. You feel how stiff you were. After a little bit of work on the facet joints, you could bend forward and it was no problem.
Right.
I didn't improve your flexibility. All I did was freed up those joints there for freedom of movement and actually caused that relaxation down the actual chain as well.
Well, I remember because you had me bending over onto the bench, and the left muscles on the left side of my, like around the thoracic region, whatever, lumbar, I don't know, were higher.
Lumbar. Yeah.
Lumbar?
That's in your lumbar area.
Right.
Yeah, so that position we put you in is one I like to use, and it's kind of a diagnosis and treatment in one. You still doing that one?
No, sir.
Okay, I think that's a no. So,
yeah.
Okay.
Okay.
That's a no.
Like, did you dental floss? No. Okay.
Well, there's actually better things than floss now. Those little skewer things.
Little pick ones. Yeah,
with the little brush on them.
Okay.
So with that particular stretch movement that we're looking at there, yeah, we could see that there was a huge restriction around that lower lumbar tying down into the hip and then down into the posterior chain, basically. Right. So for us, is it a matter of stretching? Probably not. Is it a matter of restabilizing? Yes. Is it a matter of alignment, which was a big factor for you? Yeah. Once we've got that alignment and mobility back in those joints, then the exercises we may give you, which may involve stretching, but stretching is just basically return the tissue to the length it should be.
Yep.
But I think we mentioned on a previous one before that the hamstring strength is often weakened. So people got tight hamstrings, it's because the hamstrings are often weak, and or the the core stability is not that great. So the core's having to use the hamstrings to compensate for that. So hamstring strength is more important than quad strength to a point, because people are looking at the muscles they can see, so they're always working on those muscles they can see rather than the muscles they can't see. That's why the hamstring stuff gets so neglected. Ian King, who's a strength coach from Australia, from Gold Coast actually, one of the things he developed many years ago was that looking at the proportional push-pull exercises in your training. So looking at how much rowing exercises or horizontal pulling to horizontal pushing. It should be like a 2-to-1 or 3-to-2 ratio. So 3 pulling, 2 pushing, realistically, to get people back into balance. You may even have to go 1-to-3, because we live in that society where we're so sagittal playing dominant in that position in front here, that we're so dominant this way, we don't get enough this way. And that's another way we look at that postural correction, is that strengthening of the back structure, bring you back up in alignment.
God, we're almost like devolving in a sense.
You've seen the image of the man evolution of man, and then devolving into Fat Boy Slim.
Up, and then it goes back down again. I'm thinking, what the right?
Yeah,
and now we've got problems with our kids. So okay. So what's the most amazing change or improvement you've seen in someone that you've treated? They came in and they had this pretty big problem. You tracked it down. What changed for them in their life once you treated them? And did they have to come back a number of times?
Well, they stayed with me, but I mean, like these are okay. I'll give you an example of one who's actually a good friend of mine. I'm not going to mention names for obvious reasons, but he's a good friend of mine.
Tommy G.
Now. I said friend.
I left myself open for that one. I'm glad you took it. Thanks.
Okay, so with him, he had spinal. It's not who you're thinking of either. So he had spinal surgery. One of my first patients I was working with in Los Angeles, actually. So he came in after surgery, spinal surgery, and then at that time he had gone through chiropractic and physical therapy type work, and the longest he could probably stand up for, and he's in high executive, and they had to stand up a lot, so meetings and stuff. He could stand up for probably 2 minutes before pain was like a 9, 10 out of 10.
Oh, wow.
So working with him, one of the factors was a leg length. He had like a 6 or 7 millimeter, I think it was 7 millimeter leg length discrepancy. I don't recall exactly. So we corrected that alignment, did a lot of work, and then he stayed with me because we started doing like traditional training. So he went from not being able to stand up to deadlifting 140 kilograms. Whoa. And this is a guy in his mid-50s.
Oh, there's hope for me yet.
So, and he knows who he is. He's probably not watching it because he's not really on Facebook.
Right. Okay.
He's one of the smart ones, not on Facebook. But I mean, there's one after that, after another, like cases we had like that. What I did find, which was kind of disturbing in some ways, was that every one of the patients I'd seen who come in post-surgery for spinal surgery had leg length discrepancy. Now, if we'd seen them 10 years beforehand, we may have prevented that surgery. Nowadays we're seeing some more advancements which can undo some of the damage that's occurring also, which is the new stem cell research, which we go into a little bit later. I'm actually going to talk to Anne tomorrow about it a little bit. But the new stem cell work also is seeing some really great progress along with what we're doing. So undoing some of the damage that's occurred, and then we're correcting it so the damage doesn't come back.
Awesome. Yeah, I mean, some great stuff happening around the stem cell stuff these days, and young blood and all the rest of it. No doubt we'll learn more about that tomorrow.
You would.
Right.
Young blood, yeah.
Young blood, right? So we got Anne Weston Murphy here. I lived for many years with severe pain, no matter what I did, stand, sit, or lie down. So glad I'm somewhat better and making improvement as time goes on. I've learned so much. So, go on, Pete,
next time, where's Anne? Where is she?
She might have fallen asleep already over there in Canada. She was
She's
on
in
and I think
Canada.
she's
Whereabouts in Canada is she?
Montreal.
This Anne here. She's
Oh,
in
Anne Western
Montreal.
Murphy. No, she's
Yeah.
in Philadelphia. So
Oh,
still on
I'm not
that
going.
side, but yeah,
Okay, I was going to say if
yeah,
next
you're not
time I'm
going there.
there in Philadelphia.
Yeah.
But if I'm in town, Anne, if I'm in town, I'll look you up.
There we
We'll do
go.
some work. I'll
We'll
come
do
and
some work.
do some work on you, while I'm there in town if I get to Pennsylvania. But Pennsylvania, I worked in
Ugh.
DC for a while.
All right.
That's not far away.
I stayed in an Airbnb, and I started doing the Airbnbs where you've got a room, right? Which can be an interesting experience. Stayed with the next in line, second in charge, chief of police for.
Wow.
Yeah, and he's an amazing guy. And they're growing stuff out in the backyard. They're doing it all sort of nice and clean. And we talked about challenges that he has in the police force, and a lot of the young bloods that are coming in. Talking about young bloods. So yeah, but anyway, getting back to it. So this
Hey, Anne,
guy,
I'll be in Canada, which is not too far away from you in September.
there we
Montreal.
go. Come and get some free treatment from the world's best on this stuff, Anne. It'd be worth the flight. Peter, I'd love to have you work on me. That's interesting. I don't know what to do with that comment. So
Tell me.
I do actually. I'm just not going to. The guy that had that big change.
Yes, September.
Yeah, September. Pete's going to be flying across. So what? Did he have to come back for a number of times? How long did it take to rehabilitate?
Okay, so I'd say it was progressive. Remember, he'd been in that shape, both, by the way, Elisa, both Montreal and Vancouver.
Yeah.
I'll
West
actually
and
probably
east.
be in Vancouver in a couple of weeks anyway. So I'd say he'd been in pain. He'd been in problematic probably for about 12, I think, 15 years.
Wow.
So it took us, I'd say, from the time we corrected leg length to the time where he was, say, happy that he was not getting pain, it was probably about 12 weeks.
About 12 weeks. Okay.
Before that,
good.
remember, he was going through rehab before that, after surgery for 12 months.
Right.
So he'd gone through rehab, and he just was not getting better. He was just like stagnant.
Right.
He would get the surgery, some improvement, but not much from the surgery. So it was actually minimal improvement from the surgery. And then as he went through the treatment, it just wasn't getting better. So
Right.
the person who was treating him referred up to me and said, well, maybe you need to do some strengthening or something like that. So we kind of, he was going to try something different. I mean, it was just no point doing the same thing and not getting results.
Yeah.
So the person who was doing it smart enough to kind of say, okay, maybe we should try something new. So he referred out, and then once I saw him, we kind of corrected that problem that was missed, which is not uncommon to be missed because people aren't looking for the stuff. It's nothing new, but in the sense that I'd say it's not taught very well in the mainstream medical establishment. So so once we addressed that, and it was the improvements was pretty much within a week to start to see improvements, to a point where he was out of all that pain and stuff like that. Was about 12 weeks. I have to talk with him again about it, but probably about 12 weeks. Maybe I can convince him to come on for you.
Oh, that'd be awesome, actually. If you could, that would be really cool. But for 12 to 15 years, you fixed it in 12 weeks. Did he need to have the surgery?
The damage had been done. I'd say he had to get something fixed. I don't know. I'd like to see him. I'd like to say that if we treat him beforehand and done the work, the damage would have been there, but would he need the surgery? Would he have the symptoms? Because what they found is in MRIs is they looked at MRIs of spines, and the degenerative damage done to the spine, but that's not a definite whether that patient will have pain or no symptoms. So you've had people with degenerative, disorders, but no symptoms, no pain.
Right.
So could
Wow.
we reverse some of that? And I mean, ideally, we want to prevent surgery. And now we look at new stem cells, how much that could have kind of corrected him. But I do plan to talk to him very shortly about the new stem cell that
Right.
another friend of mine just went through, and he swears by it. So I'm going to talk to this other friend to get him to kind of look at doing that as well as a going forward preventive measure, even though he's not in pain now, but just going forward to prevent any further issues on the line, because he's not getting younger, that's for sure.
Right. Wow. So people should definitely watch. What time are you on tomorrow? Because you're with Anne, you're doing stem cell stuff.
I believe I'm on my time, 9 a.m.
It'll be about 6 a.m. here in Brisbane, and it'll be late. Yeah, it's late afternoon and around dinner time, I
Anne
guess.
can confirm that if she's around, but I believe it was 9 a.m. my time, New Zealand time.
Right. So it's probably about 4 p.m., 5 p.m. in Montreal on the East Coast.
Pacific Coast time, you just add 5 hours, so there'll be 2 p.m.
2 p.m. Right.
Yeah.
Okay, there we go. All right.
Pacific Coast time.
So for those that want to watch that, wow, it's funny how many things can be subverted as far as pharmaceuticals or pills and procedures. And, maybe this could have been another one. And he'd been battling with this for 12 to 15 years. It would have been good to have got your hands on him before he went to the option of getting himself cut open to see what could have done. And maybe that could have made rehab a lot better as well, if he needed to still go under the knife.
Yeah, I mean, the thing is surgery now, I mean, you go see you have a problem, you go see a surgeon specialist, their solution is surgery.
It's going to be surgery.
Because that's what they know. Not necessarily because they want to make money, because they're getting paid anyway often.
That's all they know.
Yeah.
They could have all the right intent.
Yeah. So actually, guys, I'll post up on here at the end here what time we're on exactly, but I believe it is 9 p.m. New Zealand time, or there'll be 2 p.m. Pacific Coast time. So that's why it's always good. If you're having a problem, don't just go see one specialist and say that's the solution. Go see a few different fields and then come up with the best solution for yourself. And surgery should always be the last thing.
Today,
anytime especially with joints, anytime you start doing surgery on joints, then you open up the whole kind of Pandora's box, as far as as they say. Hi, Sean. Long time no speak.
So what should they do then, Pete? I mean, they've got some issues. Do they go to the chiro first, the osteo, the masseuse? I mean, what sort of spectrum of, or what order of things should they take before they take pharma and before they go under the knife?
I think it's looking at the individual practitioner. I mean, getting someone who's been referred to is probably the best solution. Someone who's referring you, who's had experience or know people who have experience. So a referral base is probably best. It could be a chiropractor, because often chiropractic go out of side just chiropractic medicine. They go look at maybe more different manual therapy techniques, nutritional aspects, so they can kind of go out broader sense. It could be even a naturopath may help with some factors there, but you need to get someone who's experienced with hands-on physical aspects. So a manual therapist of any kind, if they're really good, is going to be a really good option for you. It's a matter of finding the right person, not particularly the right practice. For example, you might see a physical therapist and they may be terrible, but you go see another physical therapist and they're the best you've ever been to. Right.
Okay. I mean, the point being...
I mean, actually, there's a guy, there was someone on here before, Charlie Woodruff. If anybody in New York area, Charlie was on here earlier, but I'm not sure if Charlie Woodruff in New York, one of the best out there for physical therapy. So he's an option to look at if you're in New York area.
Awesome. So look, okay. So then with posture, it's it's just amazing. When we're talking about this now, and we kind of started with having the right posture. Is there anywhere people can go online or whatever where, if they're interested in wanting to make sure that they do have a good posture and they want to fine tune, they want to do a check-in on this, how would they go about it?
Well, I
Who do they
believe
go and see?
Matt does. I mean, ideally, you want to see someone hands-on, one-on-one, okay? Because you saw what
Right.
we did with just the basic assessment. It needs to be hands-on.
Yeah. Yeah. Right.
Matt does some stuff with some videos and photo. So if you're doing
Yep.
it like
He does.
through internet,
Through FaceTime or the internet. Yep.
yeah. But ideally, seeing someone who is hands-on. We're setting up a program at the moment which will educate the practitioners for doing this stuff. So I'm working on something at the moment, and hopefully Anne's involved with the whole process as well. So, and you. So it comes down to find someone who can you'll be referred to in your area. I think it comes down to. And if you find something really good, let me know, because I'm going to put together a collection database of people around the world who are really good, and so people can go to the website and then just find out in the area who's going to be good in the area.
Awesome. Yeah, we've got some stuff coming up as well from a digital health perspective, where we're going to have a database we're going to be keeping of digital health technologies as well that can help monitor or track or even seek out some of these things.
There actually is a video technology out there. I think it comes down to an app on the on your phone or on your iPad or whatever now, that can do a pretty good basic job of posture analysis as well.
Wow.
So it takes a video, you turn it around, and it renders the video and stuff of you. So there's different ones at the moment. I mean, I think it's not like 100% yet, but there's some pretty good ones at the moment that can do a basic job of it.
Right.
But as again, there's nothing like getting hands-on, one-on-one. That, because there's such a precise assessment process to go through, and then treatment will vary. It depends on the individual. Put it in here, but it will depend on the individual, the practitioner individual, of their method of treatment. So I combine manual therapy. I combine strengthening work. I try to combine a lot of everything. I'm a little bit of a slut when it comes to this type of stuff. So I'll take a bit of everything.
Jack of all trades.
Yeah, I'll take it. If it works, I'll use it.
Yeah.
So for me, if it works, I'm not going to discount it. I'm not biased towards any particular one mode or treatment method. So if I found something works in the past, I'll definitely add it into my toolbox. And all this stuff is just part of your whole toolbox, put it together as how the practitioner uses those tools that really matter.
Right. Well, I mean, you are a doctor of physiology after all, so you're going to have a look at all these different angles of how to fix, I guess, the biomechanics of the human body.
It gives you a good foundation. The research base was basically around biomechanics as well too. But I mean, even if nowadays, even understanding anatomy now, there's some really great anatomy programs on your iPad you can get with 3D anatomy. And just having a look at that gives you a real good understanding of how that, the individual muscles, ligaments, tendons, everything kind of ties in, even the fascial system, because the fascia is a part of that whole mechanism as well. So there's so much you can do now online, and looking up, all the research and stuff on it as well. So go to PubMed, look at stuff related to posture, and the latest research on that gives you a pretty good database right there, PubMed.
Pretty good picture, PubMed. And look, this also brings us, and as we're kind of getting close to landing this, so much for our half an hour, that taking responsibility for your own health is what this is all about, right? Versus leaving in the hands of the system, which is so antiquated and behind, and has shunted out some of what's now coming back in, a lot of the holistic stuff, which is great to see at long last. But at the end of the day, you've got to take your own responsibility about for your own health, and you can today with what's online, with like a lot of the digital health stuff that we do. Execs that I'm looking after, they're like a Formula One race car driver for me, and I'm using a lot of this stuff like they use. It's biometric, but let's call it telemetry type technologies through the cloud to manage these guys and make sure their HRV's good, their visceral fat's good from their scales they've got connected to their Wi-Fi. Their Aura Ring is telling me about their sleep, and HRV as well. And I think soon, and calorie burn, and I can see when they're slacking off, But also, I think they're about to bring in meditation as well. They're going to be sensing meditationary effectiveness through the ring, right? All the
I'll suck
recovery
at that
stuff
one.
through this. Yes, a few people I know that'll suck at that one. At the moment, me included. I was back on yesterday, and only 20 birds came into my cage. And I'm used to doing 100 and something, so that's telling me something. This is
What about
using a
Anne?
Muse
How's she
device.
going? Is she beating you now?
No, I think
She's slackened off.
she doesn't want to play that game anymore.
Okay.
I think it's the only game I could beat her at. Yeah, she's staying on the battlefield she can win on. So, but yeah, you can take control of your own health, and you mentioned it before too. Precision of having an individual there, but precision nutrition, being able to do that yourself too with things like epigenetically pH 360, and some of the glycemic stuff we're seeing with Vivo as well, non-invasive blood sugar checking. So people need to take ownership of this, do the Dr. Google check, and then make sure that you leave pharma and pills and procedures last of all. There are so many other solutions. Going to bed, okay. And thanks for hanging around, mate. Any final words on posture? I mean, what's the low-hanging fruit that people should take into account to make some simple changes each day that's going to help them in this area?
Stretch. Stretch is okay. So I think we talked about this time and time again. It's only reason I say stretching or flexibility is because it's so underrated and so underutilized. Sure, there's people who do overdo it too, but looking at the bigger picture, majority do too little on that, and posture comes down to a lot more than that. But just getting that flexibility work in there would really go a long way towards everything else. Yeah.
Wow.
But your posture should be your foundation for everything else physically that you build on. It can make a mindset difference too, just how your posture's set. If you change how you're sitting and your posture, that changes your whole outcome as well.
It does. It's sort of defensive, or you're straight, chest is out, you're breathing properly, you're opening up your what's the thing that sucks in air? Diaphragm, lungs, those two. Yeah. There was something else I was going to say that you were talking about. It's gone. All right. Well, look, Dr. Pete, Dr. Rouse, this has been awesome. Again, mate, thank you for getting in the time to help change people's health and helping them take control of it themselves and putting them in the right direction. And we'll
have the video up tonight, right? So they can go over across to your other page.
Yes, on heal.me, which is the community within Middleaged Millennial. Middleaged Millennial is the page we're on right now. In there is a community, which is heal.me. I've got an executive one that I've been launching in the next couple of days as well, which is going to be an invitation only. Heal.me is for those that are interested. We've got like 450 people in there now. So I've got to load up that content. There we are. Look at that.
Sasha.
There she is. Oh, Sasha. That's the older one. Gosh, she's got that look in her eye. That's the young one?
Yeah.
Sasha. What am I talking about? So yeah. Thanks, Pete. I hope it warms up for you a bit more over there, but probably good training for Canada, mate.
Yeah, kind of get me ready. I'm actually heading up there probably in a couple of weeks. So I hear it's still a bit cool up there. So hopefully it won't be too cold.
I don't think you're going to pull a weather hammy. It's not going to be that different where you are. Coming from the Gold Coast would be a bit more of impact, as Anne realised. I don't think she's enjoying the cold right back there right now.
I saw her when she got back the first video. She looked pretty miserable.
Yeah, well, there you go. So, all right, mate. I'm going to let this go. We'll get the videos up in the next 24 hours for those that want to see what Pete did to me in checking posture and how he corrected it. And we're going to see you on the next one. Tomorrow we've got Anne Western Murphy, who just went to sleep, talking some more about nutrition. We haven't thought of a topic yet. We'll think about that over the next 24 hours. And remember to enjoy life right here, right now. When, Pete?
Maybe today.
Maybe, not a maybe, today. All right, mate. Thanks again. See you on the
All right.
next one, guys. Hill.me. All righty.
See you
Bye.
guys. Bye.